This is a CBS 4 News special report on the coronavirus outbreak in Colorado. I'm Kelly Worthman in the CBSN Denver studio. Right now, Governor Jared Polis is giving an update on the state's response to the COVID-19 pandemic. Let's listen in.
First, a quick update, 10,868 confirmed cases. We have 506 deaths today. Colorado passed the 500 death mark. We knew we would. There's many more ahead, and our hearts go out to the families of the loved ones of those who've lost their lives due to this deadly virus. I know everyone's eager to hear a lot more about this next phase, the safer at home phase. And I want to reiterate, as I've said a number of times, this is not in any way going back to normal. It's not going to go back to the way we lived our lives in January, February. It's how we can have a sustainable way of life for May and very likely with modifications beyond, a way that we can get the health protection we need, the psychological ability to endure, and the economic ability to endure for families who need to put food on the table. Safer at home for Coloradans means we need to continue to limit our social interactions to the greatest extent possible to just individuals in your household, same as before. And for those who know, the most vulnerable are people 65 and up, people with chronic illnesses. And for seniors and those with chronic illnesses, May is going to look just like April. It's just as dangerous. It'll look just the same. And we need to make sure that our seniors, those who have pre-existing conditions, stay at home except when absolutely necessary. Really, your lives, the lives of those who are most vulnerable, including our seniors, will look the same in May as it did in April. Our success as a state in keeping our loved ones and fellow Coloradans safe is about personal responsibility and doing what's best for our communities. And doing what's best means taking extreme precautions. That means wearing masks when you are out and when you're interacting with others. It means limiting your social interactions as we reintroduce many of these activities back into our lives that are necessary for the long haul. Let me show you a little bit about what that's going to look like. As I mentioned, vulnerable populations, older Coloradans, stay at home except when absolutely necessary. No gatherings larger than 10 people. Critical businesses, of course, remain open. Those are the ones you have been visiting. If you've gone out at all, grocery stores, et cetera, remain open. Social distancing, masks for employees, more frequent cleanings. And then the other retail businesses open first for curbside delivery on the 27th, and then phased in public openings with the strict precautions, similar to those precautions you've already seen, hopefully, at your local grocery store. And as customers, you should, of course, be wearing masks. The people in the stores will also be wearing masks, but that's a very important piece of making sure this works. And restaurants and bars remain closed. We're still developing what those guidelines will look like. We just don't have a trigger date, right? We don't know when that will be safe. They'll continue with takeout and delivery, of course, and then we work towards a phased reopening. We're certainly not ruling out that phased reopening during this period. These larger social environments, nightclubs, gyms, spas, remain closed. Elective and dental procedures begin again. Strong precautions to make sure that we have adequate personal protective equipment. Masks are needed for those, of course. Medical grade masks, for dental and elective procedures, of course. We need to make sure that whoever's providing those services have those before they're able to proceed with those. Because, of course, we needed so many, and we continue to need so many masks for the COVID patients at our major hospitals. Personal services, that's like salons and dog grooming and personal training, open with strict precautions. We did announce the other day, I talked to all the superintendents on the state on a call, our kindergarten through 12th grade schools are not reopening for this year. Everybody knew that was likely. Almost every state has already made that decision. While we are working on what those social distancing practices need to look like, implemented in an educational environment so they can resume in classroom in the fall. It's very hard to roll them out at the end of a school year, meaning it would take working with the staff and training them, even if we rushed and we got them issued next week. The staff would have to, instead of doing online, they'd have to learn the new way of teaching and doing it and social distancing, and then there'd be like 1 week left of the school year. So and this was at the request of many superintendents. We just made this call and said, look, we're going to focus on preparing in classroom for next fall. Let's focus on the online and everything else we're doing for the final few weeks of the school year to make sure the kids are ready for that next grade level. And of course, telecommuting continues for anybody who can, but starting May 4th, up to 50% of the staff can work in person.